The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to another edition of Aging Horizons. Today we have as our guest Janet Stellman, and Janet will be talking about Medicare. She's going to let us know all the ins and outs of Medicare, who's eligible to get it and who's not eligible. So stay tuned and we will be right back.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
A message from FireSafe Montana. Being a part of a community means working towards the safety of all. As a landowner in the wildland-urban interface, this means doing your part to protect your community from a devastating wildfire. Have you done your part? Fuel mitigation projects, ignition-resistant construction techniques, defensible space, safe evacuation routes. FireSafe Montana and your local fire authority can help. This message brought to you by FireSafe Montana and aired by the Montana Broadcasters Association.
We're back and welcome to another edition of Aging Horizons. This is a program brought to you by the Department of Public Health and Human Services. I'm your host, Wilmot Collins. Welcome to the show, Janet.
Thanks for having me. Glad to be here.
I know you're SHIP director, so what is SHIP?
Well, SHIP is a state health insurance assistance program. We are funded by the federal government, and what we do is we have counselors across the state, and we help people with Medicare.
Okay, now you help people with Medicare. What is Medicare?
Well, Medicare is a federal program that in 1965 was created for folks that were 65 and older, and it progressed into people with disabilities, children, stuff like that. But it was a health insurance for those folks because way back when, even back to when Social Security started in the early 40s, there was no health coverage for seniors. And so in 1965, under Lyndon Johnson, that was created to give health care to seniors.
So how can we enroll into Medicare? If I was 65 and want to enroll into Medicare.
Well, there's a couple really important dates for you to consider when you're getting close to enrolling in Medicare.
Okay.
The requirements are age 65 or older, having been disabled as determined by Social Security for 2 years, 24 months, or being blind or disabled, I guess, yeah. And so the initial enrollment period is when within that 6 months of you, or 7 months of you becoming 65 or older. So you have the 3 months before, the month of, and 3 months after to sign up for Medicare. So if your birthday is in April and you sign up in February, it'll start April 1st. If you sign up in May, but you turn 65 in April, it's going to start June 1st. So it's going to start the month after you turn 65, and then it's going to start the month of your 65th birthday if you sign up before. So that's called the initial enrollment period. One of the things that's important to do when you are getting close to Medicare age is, if you're working, it's really important to talk to your human resources or your benefits bureau in your insurance, because you may not have to pick up all of Medicare right now, and it may be a good idea to delay it, because if you're working and your work insurance meets the criteria, you may not have to pick up all parts of Medicare. Usually Medicare Part A is pretty automatic, and it's free to most people, or premium free. The reason it is premium free is because most of us have worked 10 years or 40 work credits.
Right.
So if we've worked 10 years or earned 40 work credits, that means that we get premium free, Part A, and Part A is our doctor services. So that'll probably start, you can have that start right away when you're turned 65, even if you're working, because it's premium free.
Right.
And it can just, supplement what you have. If you have health insurance through your employer, though, you may not have to take Part B, which is the doctor services, and that's $185 a month. So if your insurance is tied to either you or your spouse's employment, current employment, then you may not have to pick up Medicare. So it's really important for you to talk to your
human resources.
Yes, because they're the ones that are going to know how your insurance is going to work with Medicare.
Wow, that's some good information there. So a question for you. So what happens, we live in a rural state. How can someone in the rural areas enroll into Medicare?
Well, our enrollment arm of Medicare is the Social Security Administration. So they can call the Social Security Administration and say, hey, I'm 65, or I'm ready to sign up for Medicare, let's do it, or whatever, You can also go online to socialsecurity.gov and sign up for Medicare. Okay. You can also reach out to a SHIP counselor across the state, and they can help you too. There's a SHIP counselor that covers all 56 counties, or they may not live in the county, but they cover it. So there's someone there to help if somebody feels like they need assistance. So
that is decent. So I see you've used a lot of acronyms. IEP, AEP, GEP.
Okay.
What are those?
So we'll talk about the GEP, or the General Enrollment Period. So if you didn't enroll when you're first eligible for it, every year there's a General Enrollment Period, and that is January 1st through March 31st, and you can enroll in Medicare during that time if you didn't enroll when you were first eligible for it, or you didn't need it at that time. So that runs every year from January 1st through March 31st. If you sign up in January, it'll start February 1st.
So you don't get penalized for not signing up when you were supposed to sign up, do you?
Well, yes, you could. So if you don't sign up for Medicare when you were first eligible for it and you didn't have that other insurance, you could get penalized for not signing up. So
that's good to know.
Yes, and that can add up, and it's going to be a lifetime penalty too. So it's very important that when you get to 65 that you're really starting to check things out, so you don't miss the boat on it and have a lifetime penalty for not signing up.
Whoa, that is good news to hear, because I'm getting near there. I need to start thinking about that. Janet, thanks for giving us all that information. I know it's been helpful to me, and it's been helpful to my audience, so I appreciate it. And we'll be coming back to talk about Medicare options. So I want my audience to get their coffee, their tea, and stay put, because we will be right back to talk about what your options are in Medicare. Stay tuned.
Hey caregivers, did you know that respite time is your time? How will you spend it? Respite is really perfect for things I like to do, but my son isn't interested in.
Vicki Henry, Manhattan.
Gardening isn't one of his favorite things, and he knows and likes his caregivers a lot, so it's a win-win. Or even something as simple as a bike ride becomes possible when I know that someone I trust is with him.
Montana Lifespan Respite. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
It's good for both of us.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Medicare loses $60 million in Montana each year, $60 billion nationally. Medicare processes 4.5 million claims a day. They don't know who your doctor is, but you do. Mistakes can happen. Read your Medicare statements and call Montana Senior Medicare Patrol if you see anything unexpected. 1-800-551-3191. This project is supported by a grant by the Administration for Community Living.
We're back, and we have been talking to Janet Stelman of the Montana Department of Public Health and Human Services. She is SHIP Director. Janet, thanks so much for all the information you provided on Medicare. And let's talk about what are our options, Medicare options. What are some of those?
Well, there's two different options to get your Medicare. The traditional model, or the model that's been around the longest, is you have Medicare Part A, which is your hospital insurance, and you have Medicare Part B, which is your doctor services. Okay. So we talked about the premium for Part A being most of us don't have a premium because we've worked the 10 years or the 40 work quarters. If we didn't have the full 10 years or 40 work quarters, the total premium of that is like $550 a month. And then it goes down for, maybe you're close to having the 10 years or 40 work credits. Right. It's like 250 or something like that. But Part B is 185. Part B is your doctor services. So anytime you go to the doctor, your durable medical equipment, stuff like that. There's also Part D. Part D started in 2003, right around there. It was the first time there was prescription coverage for Medicare beneficiaries. So prior to that whole span of 30 years or whatever, there was no prescription coverage for Medicare beneficiaries. So starting in 2003-ish, Part D was started so people could get prescription assistance. So that's one way going. That way is 80-20 split. So Medicare pays 80%, the beneficiary pays 20% after all deductibles and stuff. The other way to get and you can go to any doctor that takes Medicare. Right. So the other way to get your Medicare is through Medicare Advantage plans or Medicare health plans. So this is where these private insurance companies say, hey, we can take care of, this person's Medicare services, just Medicare, give us some money and we'll take care of it. So Medicare gives them this pot of money and says, okay, here you go. And so these are companies like Humana, United Healthcare, Blue Cross Blue Shield, stuff like that. And so they take care of your Part A, your Part B, and your Part D if you need a drug plan. A lot of times you'll hear this as Part C. So the main difference between those two is that Medicare Advantages require a network, so a lot of times you have to go to a in-network provider or a preferred provider. Instead of paying 80-20, maybe every time you go to the doctor it's $5, or every time you get labs drawn it's $20, or every time you go to the emergency room it's $150, whatever. Another thing is that it has to cover everything traditional Medicare covers, but it may cover something extra, some extra stuff. And some of that can include dental, vision, and hearing. So that's important to people because traditional Medicare doesn't cover that.
Right.
And so these Medicare Advantage plans, you know, they may not be a lot or real robust coverage, but at least it's a little. So sometimes that's appealing to some people. Also, there's what's called maximum out of pocket. So with traditional Medicare over here, it can go 80-20 all year long.
Right.
With Medicare Advantage plans, there is a maximum out of pocket. So let's say there is, one of them is like right around $4,500 and all the way up to $12,000 a year. So $4,500 in network up to $12,000 in and out of network. So that means if you're going to all providers that are in your network for your plan, and their maximum out of pocket is $4,500. That's all you'll have to pay for the year for your medical expenses, covered medical expenses, and then the plan's going to pay the rest. So that's kind of, you know, it kind of gives you an idea of what your maximum costs are going to be. So
you can start planning.
Right, and Medicare Advantages aren't available in every county in Montana, last I knew. And it has to do with that network of providers. If you're up in some little tiny town, there's not a lot of providers that are maybe in their network, so they may not have a Medicare Advantage plan there. So your only option would be traditional Medicare. With traditional Medicare, going back to traditional Medicare, because it's an 80-20 split, there's what's called Medicare supplements or Medigaps. Those are specialized plans that are available in Montana, and you can get them to help pay that 20%. They're usually a couple $100, $100 to a couple $100 every month, depending on the plan. And there's like 12 different, and it's like if you pick Plan A, every company that offers Plan A is going to look identical except for the cost. You know, Plan A here might cost $100. Plan A over here might cost $350. Why? I don't know, but they have to cover the same exact thing. So, and they go up to, I think, Plan F or something, or L, and they're just different coverage. So SHIP counselors can help you look at those. You can also go on to Medicare.gov and look at those, get an idea of what they look like and what plans are available in Montana. So that'll help with the 20%.
Yeah, because, you know, 20% may seem small, but 20% of $5,000 is a lot for some of our older adults in rural areas that can't afford that kind of stuff. So yeah, I was concerned when you said 80-20. I said, oh, that's not too bad. But hey, when you look at the numbers, it can get really brutal.
It really can.
So are there any other helping programs that you know of?
There are a couple helping programs that SHIP counselors love to talk to Medicare beneficiaries about. The first one is the Low Income Subsidy Program, and it's administered through the Social Security Administration. It is to help with Part D, or the drug benefit. We know that drugs can be so expensive, and if somebody can get into low income subsidy, it can help with those drug costs. The other one is the Medicare Savings Program, MSP we call them. They can help pay that $185 Part B premium, and that's an extra $185 people can have in their pocket.
Wow, thank you. Thanks, Janet. And to my audience, we'll be right back. Stay tuned. We will be discussing next our SHIP counselors. Stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
We're back, and we have been talking to Janet Stellman, SHIP Director for the Department of Public Health and Human Services. Janet, we were talking about helping programs. So tell us, what are the other helping programs that we have?
Yeah, I just wanted to touch on one more real briefly. That's the Big Sky RX program. It is a state-grown program that came out through the Schweitzer administration, and it's a helping program to help some of those Medicare beneficiaries that have a little bit higher income and maybe have higher resources than the other two programs have. It's just a little help. It helps pay up to $50 of their Part D premium, their drug benefit premium, per month. So that's really helpful. And you can call a SHIP counselor and they can hook you up with that program and help you apply.
So that's awesome. So tell me, what are SHIP counselors?
So SHIP counselors.
Who are SHIP counselors? Okay. You know,
SHIP counselors are your neighbors, people in your communities. They're local people that live and work in your communities. They are trained in Medicare. They go through a 2.5-day initial training. Actually, they have to do 20 hours of Medicare modules. That's pretty dry. And then they come through a 2-day training. And then they get ongoing training throughout the year. But they learn about Medicare. They learn about traditional Medicare. They learn about Medicare Advantage plans. They learn about Medicare supplements. They learn about these helping programs we talked about. They learn about how to file appeals or how to work with people when their issues arise. So there are 9 area agencies on aging, or ADRC, and 8 aging and disability resource centers across the state, and there are SHIP counselors in every one of those.
Oh, good.
And so even though they don't live in a county, they cover a county. So they're available by phone. You can usually go into their office, make an appointment to go into their office, whatever. But they're there to help you. And the busiest time of year that we see is during initial enrollment period, and that is October 15th. October 15th through December 7th. That is your opportunity every year to make sure that your coverage is going to be the best coverage for you next year.
Right.
Because if you don't look every year, you may get a big surprise January 1st. So
and what could that surprise be?
Well, your premiums go up. Maybe your company has left the state. Maybe they're not covering all of your drugs that they were before. So even if you think you got the best thing going on, it's always important to change or to look, at least look. It doesn't hurt. SHIP counselors are free. We're non-biased. We don't have any skin in the game, so we're not going to recommend one company over another. We're going to look out for you and try to get you into what works best for you.
You're just there to help.
Yes, and we're confidential. We're not going to tell your neighbor that you came and saw us. And sorry, there was a fuzzy going around. Or we're not going to tell our coworkers, oh, you know who was in here? No. We are looking out for you. We are your advocate.
Right.
And we're confidential, non-biased, and we just want to help.
So what can those SHIP counselors that are spread out in the area agencies, what can they do to help Medicare beneficiaries?
Well,
what are some of those things?
Like I said, they can help people sign up for Medicare. If there's issues going on with their Medicare, maybe they lost their prescription drug plan, they can help figure out what's going on there. They can help them apply for those helping programs that I talked about. help them with appeals if they don't agree with an action that Medicare has taken. They can file an appeal, and the SHIP counselors can help them.
Oh, that's good.
One of my favorite stories of what a SHIP counselor did one time, this was several years ago in the eastern part of the state, and we had a big, huge snowstorm, and this poor couple was like snowed in, and they couldn't get out, and they couldn't get to the pharmacy to get their meds.
Oh, boy.
So this SHIP counselor and her husband, with the approval of, with the okay from these people, went to the pharmacy and snowmobiled the prescriptions up to the people. I mean, that's not the norm.
No,
but that's
Montana.
But that is Montana, and that's the heart of our SHIP counselors. That's like one of my favorite stories to tell.
That is a good one. That is a good story. Yes. So, our adults live in these rural areas. You just gave us a story where they could not get to the pharmacy to get their meds. So what happens when our older adults cannot get in touch with a SHIP counselor? How do they manage? Because I know you mentioned they can call. With our weather, sometimes the phone lines are down because of heavy snow. What's out there for them?
Well, through COVID, we've learned how to do a lot of things over the phone. We never thought that would be possible, but if one good thing came from COVID, it taught us how to, do more stuff over the phone and over the internet. And there shouldn't be a reason why somebody can't get a hold of a SHIP counselor. We have over 125 of them across the state. Wow. And not only do we have them in the ADRCs and the area agencies on aging, but they're also set up in the major hospitals, most of them. Oh. And there's community health centers, urban Indian clinics. So they're just kind of strategically placed all over the state. So you never know. If by some reason you couldn't get a hold of, or you needed more immediate attention and you couldn't get a hold of one right away, you can always call 1-800-MEDICARE, and 1-800-MEDICARE can help too. 1-800-MEDICARE is open 24/7.
Okay.
So if we always, especially during our busy season, we're always like, if we direct somebody to 1-800-MEDICARE, we're like, yeah, call them at 11 o'clock at night. Call them at 5 o'clock in the morning. That's going to be the slowest time for them and the easiest to get a hold of them.
You bet.
Or you wake up at 3 o'clock in the morning and you're worried about something about your Medicare, call them. They're there.
And they're 24/7.
The 1-800-MEDICARE line is 24/7, yes.
Wow, that's awesome. And thanks, Janet. We appreciate it. I learned so much today from the information you provided. So I want to thank you. It was a blast. So this has been Aging Horizons and your host, Wilmot Collins. Thanks for watching. See you later.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.